Morning, folks. We are waiting for more people to come on to the annual address. Welcome to the Managed Care Data Quality Monitoring webinar. We do this monthly. This is our annual address, and we will probably start around 10:05. We just want to make sure that everybody who wants in can come on in and listen. But thank you for joining and being on time. And don't worry about muting because we can mute you now. We figured it out. Thanks. Just another quick check-in for folks who are coming on. We are going to wait until about 10:05 and then we'll start up, promise, but welcome. Again, welcome. We'll be starting in another minute, but I know that we still have more people coming on, so thank you for being as prompt. Run and get a cup of coffee, and we'll be right back. Good morning, everyone. I'm starting my video. Whoop. Things are working a little slow today. Welcome to the Managed Care Data Quality Monitoring webinar. This is our annual address. So we have now completed a full year of webinars for folks, trying to be inclusive, focusing on topics related to data collection, and how data should be coming in from the plans, counties, and providers. Next slide, please. I'm Amy Peterson, the Managed Care Data Support Section Chief, and we are here to talk to you about our EDM organization as a whole, the Managed Care Data Systems and Quality Monitoring, and the communication that we have tried to make as robust as possible so that you have access to the people that you need. We'll also go over some next steps, and we'll have a closing message from our division chief, Dr. Eugene Stevenson. Next slide, please. Today we'll have Dr. Stevenson and one of our colleagues, Deborah Dixon, speaking, as well as myself. Our support team includes Atif Habib, Samantha Van, Abi Geber Salasi, Mei Shan Eng, and Sujung Kim. She oversees a lot of this, and Atif Habib is actually, this was his last webinar with us. He's moving to Connecticut, and we will miss him very much. Questions and answers. For general questions, please go ahead and submit your question to the WebEx chat. Don't go sending it to the host directly, because the host is not monitoring private chats. Please go ahead and send to all in the chat, and if you have a specific question, go ahead and send that to the appropriate mailbox that comes up at the end of this webinar. We put the appropriate web mailboxes in all of the webinars, and they're all live links when we post them, so you'll be able to access those folks as soon as this is posted on the web. So again, for specific questions, you can also contact us at mcdss@dhcs.ca.gov. And before we have Dr. Eugene Stevenson do our introduction, we'd like to get a little idea about what you like in this webinar series. We would love a little interaction from you as participants, and you can use your mobile device to capture that link, the little square link. I don't remember what those are called. It's a URL, and then QRL, and then the actual Menti link is also in here. It'll be in the chat with the Menti code, so you don't have to try to remember it. And then when we post this, we'll post it with the results of the word cloud. So instead of all of this, folks will be able to see what you were thinking at the end of the 12 months session. The other thing that we will be doing is submitting through the listserv a survey to capture ideas about topics, things you find relevant, see if there's anything that you want to focus on more subtopic category wise as we approach this next year. Since April to April has been the full 12 months. So if you've had a chance to go ahead and start the Menti link, we're going to go to the results and see what you're putting in, just kind of get an idea of what you're thinking. And you can continue this throughout the whole webinar if you want to go pop over there and put some more comments in. Go ahead and share. Let's see these results. Great. Wonderful. So we are seeing that informative is coming up pretty big, and again, with 19 responses, that's nice to hear. We'd love to hear more responses. So go ahead and use the chat to capture your opinion about this webinar, and then when you do see the listserv survey come out, it should be May. We have to go through a whole process of review before we can release it, but it will capture topic ideas that you have as participants. So you can go ahead and go to the results too. Those should be in the chat, and you can take a look at what folks are putting in this response part. Okay, next slide, please. Go back to that. Thank you for participating. We really appreciate it. Your input is valuable. Okay, right now I would like to introduce you to Dr. Stevenson. He did start this project off and he has been a wonderful sponsor, and I'm going to stop my video and move it over to him. Thank you so much, Dr. Stevenson, Program Data Reporting Division Chief.
Good morning, everyone. And, first, before I get started, I want to thank all the participants and, just the time that you've made throughout the year to join us here on this journey of improving data quality with inside of DHCS and the process of improving that data quality throughout EDM. There are 9 branches and 3 divisions inside of EDM that are entrusted with the process of ensuring that the data is of high quality and that we're able to report out on that and show all the hard work that's happening with inside the county and the plans. So thank you for all your partnership and thank you for your feedback so that we can continue to improve the process and improve your data and how it shows publicly. I would also like to thank the team for this year of work that they've done to put these slides together. It takes an incredible team of 7 to 11 individuals that go throughout all of the department, scouring different topics and the salient subtopics in order to present this monthly. They post it online and ensure that this is here for, posterity's sake and the opportunity to inform new individuals to the organization or to new plans. So, I really would like to take the opportunity to thank them all for the work that they've done and putting this forward and creating a public face for EDM. Here on this slide, walking through the EDM organization as it has matured and continued to take more firm shape. The 3 divisions inside of EDM are HIMD, PDRD, and DAD. The Health Information Management Division, as you can see there, establishes a data quality management organization. They help create the architecture, the scaffolding that the other 2 divisions, PDRD and DAD, use to align the data that we receive in order to report out on it consistently and to different types of stakeholders to include the federal government. HIMD establishes the data quality dimensions. This helps improve our reporting and enhances our decision making. As you can imagine, high quality data that comes in quickly is easier to make decisions. Those decisions are then driven on the information that we receive, and a positive feedback loop is created between the department and the plans and counties. The Program Data Reporting Division, which I'm honored to lead, provides data analytics and also reporting activities for DHCS business lines. Said a little bit more colloquially, we provide stewardship to the other program divisions inside DHCS. So Managed Care Quality Monitoring Division or Integrated Systems of Care Division, all of these different programmatic divisions that are dealing with the managed care plans or helping the counties and the mental health plans understand the policy, get that data across the line, and then report it publicly in different objects and different types of proof of concepts that we see online looking like Adobe PDFs or as ArcGIS types of reports. The 3rd division inside of EDM is the Data Analytics Division. They also provide data analytics. However, those analytics are informed a little bit more scientifically. How do we say? They help inform the methodology with which those reporting analytics occur. And they do that for the external departments, and they also do that inside of DHCS and EDM. DAD also helps provide data governance and data fulfillment. Here are all of the EDM divisions and branches as a list. A little bit easier to understand perhaps how the information flows through EDM and then out of through public reporting. Health Information Management Division has the data exchange and delivery branch, data quality branch, and the business intelligence branch. Program data reporting division has the managed care plan data support branch, community program data support branch, and the benefit and eligibility support branch. And then lastly, data analytics division has the data governance branch, data science branch, and the data fulfillment branch. So as you can see here, the way that it's organized and the way that the names kind of indicate, the Health Information Management Division assists in the exchange, helps stand up that exchange between plans and the department or between counties and the department. It has the branch that is monitoring the quality on a monthly, quarterly, annual basis, and then a business intelligence branch that helps program data reporting division and the data analytics division create public reports that are interactive or more intuitive to use by utilizing ArcGIS for as a method or as a tool. The program data reporting division, managed care plan data support branch is a primary data steward to many of the divisions inside of DHCS, primarily entrusted with the task of managing managed care. So the managed care health, but also managed care behavioral health and managed care dental. So all of those responsibilities fall within that branch. The community program data support branch is entrusted with many of the waiver programs and some of the other legacy programs, and also behavioral health programs that happen at the county level. So much of the specialty mental health. Benefit and eligibility, they help establish what should be a benefit and how it is reported, how it can be reported. They're also a primary steward to the eligibility division. In the data analytics division, the data governance branch helps provide rules with which that data is governed inside of EDM, but also DHCS. The data science branch is an even more technically sound branch that helps provide really down in the weeds support when programs or when researchers need help identifying places in a warehouse or relationships between the member and the data. They help come in and establish that linkage so that the reporting is consistent and aligned. The data fulfillment branch, they help with PRAs, they help ensure that really large requests get done and get done on a timely manner. They also help organize large requests so that many different branches or divisions inside of DHCS or EDM are activated on time. Highlighting here a little bit of PDRD and the Managed Care Program Data Support Branch. Specifically, they assist DHCS program divisions. They do this by creating ad hoc data requests. The request is sent in through ServiceNow. Researchers and scientists are at the ready to help with reporting daily, weekly, so on and so forth. They maintain customer service with the program area. It's part of the staff in the managed care program data support branch to maintain relationships with those program areas so that the division can understand what the program area needs, how that's related to the policy, and what type of coordination can occur so that seamless data reporting happens on a regular interval. They create and conduct this webinar, create proof of concepts, and also ensure of data reporting and alignment. Thank you so much. Appreciate your time. And with that, I will pass it to Deborah Dixon.
Thank you, Dr. Stevenson. It looks like my video is not working. Let's see if I can change that. One sec. There it is. Sorry about that. So thank you, Dr. Stevenson. As he mentioned, my name is Deborah Dixon. I am the Data Quality Branch Chief here in the Health Information Management Division. Next slide, please. So we're going to talk about the data quality monitoring and the submission standards, as we've done with some of the prior webinars. As mentioned, we've been doing this for about a year now. So we've been going through how things get submitted and where they go. In this diagram, you see the medical managed care data submission flow that comes into our post-adjudicated claims and encounters system, also known as PACES. So there's edits and audits in place that check the accuracy of the files that come in. Keep in mind that this is the medical managed care, as we mentioned. Earlier, we've talked about dental and behavioral health, so we'll get more specific on those separately. The behavioral health claims go through the short Doyle Medi-Cal system. Dental has its own system, and the behavioral health does send their 274 provider data through PACES. So just to keep all of that in mind as we're going through this today. Next slide, please. CART dimensions, as we've said before in previous, we always go through this in the previous webinars. We talk about our completeness, accuracy, reasonability, sometimes known as consistency, and timeliness. So we take a look at, you see the descriptions there. Completeness, of course, refers to having all the relevant data without any missing values, whether it's accurate or not, representing real world events, etc. The reasonability, we want to make sure it's logically consistent with the context of the data. And the timeliness, of course, as the name implies, is the submission of the data meeting whatever that timeline is. Next slide, please. All right, so our general data submission rules. So all the plans and counties, of course, have to submit their data to us related to their providers, the services they provide, and their members. So since we've been doing these webinars in the past, these links are going to take you directly to where you need to go. The data submission and requirements specifically are there. You see that webinar series page. There's a whole page that provides all that information. And then for the MCPD and the PCPA, that's from December of 2023. That link will take you directly to that particular webinar. The submission reconciliation form, same thing. You'll see that slide. The behavioral health short Doyle Medi-Cal requirements. And then lastly, the encounter data overview. You'll see that on the slides in that link. Next slide, please. Okay, so for 274 medical, when we say medical, we mean the physical health, not behavioral health. 274 medical data, monthly submissions no later than the 10th of each month. The submission reconciliation on the 15th of every month. There are also monthly data checks and semi-annual data checks that are done with the plans on the 274 data. And then from May of 2023, you can see directly by clicking on that link to get to the slides. All right, next slide, please. Behavioral health. Short Doyle Medi-Cal, as we mentioned before, that's where you're going to get the mental health and substance use disorder claims are going to go through that Short Doyle Medi-Cal system. That link that you see there is going to take you to the MedCCC, which stands for County Claims Customer Services Library. So when you click on that link, it's going to show you the Medi-Cal manuals, reference guide for the codes, NDC list, fee schedules, all the kind of information that you would need to know about that. Little different with Short Doyle in that the claims can be submitted daily, weekly, monthly, or whatever timeline counties have chosen. The timeliness requirement to keep in mind with those claims is that the original must be submitted within 1 year of the month of service, and then the replacement claims within 15 months of the month of service. Next slide. All right, so we're planning some updates for the 274 for both behavioral health and dental. So we are in the process of applying the checks like we do with the medical managed care, and we'll be communicating what those standards are in upcoming webinars later this year. So the link to the slides from 2023 for all of three of those, the dental data, behavioral health, mental health, and the drug Medi-Cal presentations are there for you to review. Next slide. Encounter data quality. Again, we're talking medical encounter data. You can click on this link to get to the slides to see what that's about. And here are how we're measuring and reporting currently today. The QMED would be familiar to those of you on the phone from managed care plans, the quality measures for encounter data report cards. So we do have 7 threshold measures that we're using to calculate the grade that they get. It averages the 4 quarterly grades to get to the grade point average. And then those are released in February, May, August, and November. As some of you may know, we are in the midst of updating that and taking a look at both that and the stoplight encounter reports and maybe changing those measures. Specifically, the pharmacy would be carved out of the QMED report. So since we haven't been measuring or necessarily using those report cards at this point for caps or sanctions or related to that program necessarily at this point, we will make sure that we bring forward the appropriate measures, any changes that come to those reports, or what the end result is once we've analyzed what we're going to do with the QMED and the stoplight encounter reports. All right, next slide. The JSON file expansion. So some of you may be aware the Enhanced Care Management and Community Supports template was converted to that JSON file. They are progressing in sprints, doing the iterative type of implementation, and they're leveraging that QIMR report to validate that. So for those who may want to share this with your teams on the other side, those that make the files, here's just a description of what the JSON file data is, what kind of format it is. It's an open standard and a data interchange format that uses human readable text. So that's typically used in electronic data exchange, which is why we are converting files over to that JSON format. So more to come later this year in the webinars on how that's going to take place and at what time frame. All right, next slide. So at this point, I'm going to turn it back over to Amy to talk about communication.
Debbie, thank you very much. Right now, I'd like to see if we can't get the word cloud back up and let you see all of the responses so far. We average about 200 to 250 folks for each one of the webinars. We're seeing a lot of uptake on the webinar page and people going ahead and downloading and viewing on YouTube all of these webinars. Right now we have 39 responses. If you'd like to put in your 2 cents about what you think about this webinar series, feel free to do that. We wanted to give you an interactive opportunity to work with us a little bit. We know we've muted you all, but it gives you a little ability to give us some feedback. And again, a reminder, we're going to be sending out a survey that will help glean more information about topics and subtopics that appeal to you or that you need to hear from DHCS to increase all of the communication and ability to report data and avoiding any of the pitfalls that happen for managed care plans providers, and then also working with programs more collegially. So those are the kinds of things that we're really looking forward to doing as this new year comes to pass. So April to April is our special year for this particular series. Going back into the webinar, those slides, we're going to go ahead and cover some information about who to communicate with. Who are the people in your neighborhood? Who are you reaching out to when you have a question? So when you have a question for 274 medical or physical health, as Debbie pointed out, it's the MCQMD provider data mailbox at dhcs.ca.gov. These links will all be live. So any of the slide links and all of the email links will be live when we post this. It takes about 2 to 3 weeks to post up on the web. But again, that webinar page has lots of details about all of these folks as well, or all of these web resource mailboxes. So the 274 behavioral health plans, MHP and DMC ODS, need to go to the 274 expansion at dhcs.ca.gov, and the 274 dental at DMC deliverables at dhc.ca.gov. And counter data is a little bit different. It's MMCDE for encounter data@dhcs.ca.gov. And so if that message is urgent, please mark it urgent in that subject line, as well as put the context of your message. So if it's a question about DMC deliverables, urgent, those kinds of things. Next steps in our planning and what we're thinking about doing. Again, I've mentioned the survey that's coming hopefully in May. Again, we have a review process here that can be kind of lengthy, but I'm looking forward to seeing results soon. And I'm hoping that we can present some of that data in our July quarterly webinar. So next slide, please. For communication with us here related to data group mailboxes that have a more general context, and your BH Short Doyle folks are at medccc@dhcs.ca.gov. The DHCS Documentation Center access requests, and those we have been definitely approving as soon as they come in, is at the data exchange at dhcs.ca.gov. Any technical questions that you have related to the healthcare data can go to the EDM data support at dhcs.ca.gov. And again, our section will help you route if you don't know where to go at mcdss@dhcs.ca.gov. One of the things I can tell you is that folks who are out in the community or in the managed care plans or even at DHCS internally are subscribing and unsubscribing on the webinar page. And we are actually seeing a lot of requests going down as we see those subscriptions go up. So we have some measurable metrics that we're looking forward to being able to share with you if you're interested. But again, MCDSS, we're very much about providing that customer support, linking you to the right people. Takes us a while to hunt folks down. DHCS is huge, but we will get you to where you need to be. And so if that message is urgent, please mark it urgent. If it's a basic question about the webinar, like when are you publishing it, we'll get right back to you as soon as we see that message come in. DHCS data collection status. Most of this is all in production. 33% of DMC ODS plans are in production. We have tried to update the status slide every month as we present, just so that you have an idea of what DHCS planning is or where we are in the process. But pretty much all in production. So everybody's turning it in. We are able to actually use that data at DHCS. Next slide, please. Okay, so if you're unfamiliar, if this is your first rodeo, then you might not know we have a full webinar series webpage that we have designed and tried to make as robust as possible for you to be able to access all of these webinars routinely within about a month after they are actually created. We've been recording them since the beginning, publishing them alongside with the transcripts, the slide decks, all of the live links, and the FAQ and glossary page about different things and subjects that we have actually covered. And then the other thing that we have is within that glossary page, those are related to what we've actually spoken about in the webinars. I mean, not everybody knows what the acronyms all are, and so we need that information. Everybody needs it. So we try to be as transparent as possible. Next slide. This is what the actual web page looks like. Oh, go back one. That's okay. This is what the actual web series web page looks like. As you can see, it's listed by date. It has information about what we're trying to do and some contact information, a way to go back and forth between the quality monitoring page as well as our data quality monitoring webinar series. It's a mouthful. But again, recording the script, the PowerPoint slide decks, the webinar schedule as planned, and then how to get on the distribution list. The frequently asked questions, if you send those to us at MCDSS or you put them in the chat here, and they are appropriate for the FAQ because they can be distributed throughout and made public, those are going to go ending up in the FAQ. If there is something more specific, we will get you to who you need to speak with, a subject matter expert for your specific need. Next slide, please. Okay, so I've been talking about it through the whole webinar, the Survey Monkey. So Survey Monkey of the managed care plans and counties. We're getting some help from another team here at DHCS. We really appreciate them. They're EDM support, and they're helping us develop a Survey Monkey survey for managed care plans and counties and DHCS participants. It's going to go out to everybody on our listserv, and we will be reaching out around the beginning of May. This webinar page will have a link to that survey, and it will be open for the amount of time that we're using the survey to collect data. Suggestions will be incorporated as possible. If you give us your contact name, the role that you have at your department or at your business of employment, and then your email and contact information, we will reach out for more focused interview questions, especially if you have some specific needs that you think need to be addressed. And your questions will be answered or posted in that FAQ page so that if it's something that's topical, we can actually produce something that will be available to all. Next slide, please. Okay, the upcoming webinar schedule. So again, April to April, that's our annual. So we have had a full year of run, and we are putting up now the 2024 months and schedules on the web page. This one will probably be within about 3 weeks, give or take. So look for it. We'll send out an announcement when it does get published. And then in May, we are going to be discussing 274 medical managed care provider data. So if you have some questions now, go ahead and send those in. We can maybe try to incorporate some of your ideas. That would be really good. And then let's see, we have the 274 MHP mental health plans. We have the semi-annual data checks coming up in July, which is when I hope that we have results from the survey. We can start really incorporating subtopics and topics that interest you about what we're doing here in our focus. And then the encounter data is in August, and September is the 274 for dental. Next slide, please. October is another one of those monthly check-ins, so it's the monthly data checks. We'll be talking about DMC ODS in November, and the December 2024 is going to be the MCPD, PCPA, those provider data files and expansion. And January is a semi-annual data checks check-in. February is going to be behavioral health short doyle, which can have some really specific topics. And if there's something that you want covered that's not already been in the webinar that we did earlier, let's do it. March 2025 is quantitative and qualitative data templates. We covered that last month. There may be something specific that comes up. And if there's something that you're having an issue with or a concern or a question about, definitely reach out and we'll try to incorporate that as a subtopic in March. Next slide. For our closing, I'd like to bring on Dr. Eugene Stevenson one more time. Really appreciate everyone sticking around and participating.
Thank you, Amy. I would just like to, take a couple minutes again to thank everyone for your partnership. This truly is only possible with everyone making time on their schedule, logging in, being receptive, and also being critical. I think it takes a certain amount of courageousness, a certain amount of courage to be willing to, think critically and then offer feedback that helps the group get better and also helps the webinar series get better. It's been a distinct pleasure of mine. This is one of my favorite projects, and I enjoy talking to the state every single month about the different quality issues or resolutions that we've found along the way. As we go forward in the next 12 months, it'll be an opportunity to create more specific webinars that might be different in their length, but more specific in their address. So we'll get further in the weeds about the JSON file specifically and how it supports the department. We'll get further into encounters and the way that they're submitted by different types of organizations, like perhaps FQHCs or even from the county. So as we continue to go forward, please rest assured we will find more exciting topics in the world of data quality to present, and we look forward to sharing this ride with you. We're going to take some time to look in the chat and answer some questions. So we'll take a look in there. I'm going to take the last question submitted and the best one here. So what happened to the beard? You know, I was riding my bike last summer, and washing it was harder than keeping it. So I was having to keep it up all the time, and it was meant to be something easy, and it became something hard. So I had to give it a cut. We are going to kind of go through the questions up and down the chat. So just give us a moment, and we will start answering questions from the top. The link to where the recordings are at, I think that was posted. Thank you, May, for that. Today's slide and presentation, we generally don't post the same day. We have to go through the presentation material. We've got to get approvals throughout the department in order to post. So it's generally a 2-week lag, give or take a week. From Thomas Mendez, is this the division who monitors data quality on the carved out bidirectional plan data feeds DHCS is sending to HCPs? EDM as a data organization as a whole is the organization that is monitoring that. And then, you know, in concert and coordination, the 3 divisions are ensuring that the data feed is flowing as appropriate. And when you have questions regarding that, then we make sure that you're able to talk to the data architects and the exchange branch. Jose Mendez, when will the Medi-Cal managed care performance dashboard be updated? Last update was January. I believe it's getting updated right now. I think by the end of the month, right at the beginning of May, you should see that update on the website. And we have a few extra minutes, so please, if you have a question, place it in the chat. Nothing too critical, nothing too happy. So we appreciate your feedback.
We'll put up the word cloud for folks to see what the results have been so far. But feel free to go ahead and put your questions in our chat.
I think Amy had said earlier that this will be available through, after the webinar is over. So really appreciate the responses. We're definitely going to take this information back. Trying to find a way to make the presentation even more elegant, a little bit more efficient, even more straightforward, so that you're able to decide and decipher whether or not this presentation or the next presentation, previous presentations are the ones that will help you most that week, that month. As we reach a quarter to the hour, we're going to just take one more second to cycle through the chat. Again, if this isn't the only time we take questions, so if something comes up later and you're feeling inspiration, please just send the question to mcdss@dhcs.ca.gov, and the staff within the division will be sure to triage your question and make sure we get an answer to you ASAP. And if it's applicable for the FAQ, then we'll get it in there as well. Continue to go by the website. We update it monthly. I have a feeling it's going to expand. So as that expansion occurs, we will be sending out updates to our webinar listserv to make sure that the traffic past the websites is occurring. We appreciate your partnership. And again, if there's anything that we can do for you, if you're having any issues or troubles with Exchange or quality or reporting, please reach out to anyone on the team here, and we will help you. I hope you have a great rest of the day, rest of the month, and take care.
See you next month.
Did you?